item 2 on the order paper. Communication from the chair.
Honourable members, I want to welcome you to this afternoon sitting. The Uganda Parliamentary Fellowship announces the 9th Women Forum of the Uganda National Prayer Breakfast, which will take place on Tuesday, 7th October at Hotel Africana, starting at 7 a.m. You are accordingly notified and invited. Honourable members.
Thank you, Right Honourable Speaker. Right Honourable Speaker, I want to thank the House and to thank you for the good work you are doing for this country, more so in the areas of healthy. You know, when you have healthy population, then it means you have a good working population. Right Honourable Speaker, as you have stated, that when you look at Kamuri Hospital, it's not only that Kamuri Hospital treats only the people of Kamuri, but I want to assure you that even we as the neighboring district, people from Jinja, we also go to Kamuri for the same. And when you look at Busoga as a sub-region, the 12 districts, the only referral hospital that we have is Jinja Hospital. And when you go to Jinja Hospital, is densely populated. Not only that, we have the new constituencies, Right Honourable Speaker, like my constituency. As per now, it's the policy of this government for each constituency at least to have a health center for. But up to now, my constituency, we have one of the health center 2s and the 3s. Right Honourable Speaker. Thank you so much.
Thank you.
Honourable Speaker, I want to take this opportunity to thank you, and I rise on reaction to your communication, and also thank honourable members for Bujiri Hospital. Right Honourable Speaker, I want to specifically thank you that this is the second big achievements we are getting in Busoga under your leadership. You remember very well the issue of Busoga University was sorted by yourself. Yesterday, Bujiri Hospital came and it passed in this House, Right Honourable Speaker, and I know more things are going to come, and we are very proud of you, Right Honourable Speaker, as Busoga and as members of Parliament, and I know you are going to take care of the interest of all the other regions so that we move together in unison, Right Honourable Speaker. Information, Basalirwa.
Thank you, Commissioner, for giving way. The information I want to give is that the Speaker actually has all the right to favor Busoga because she's actually part of Busoga, as you are
Honourable
aware.
members,
That's the information
I am a national leader. I am a national leader. What I do for Busoga, I do it for all other regions. But as if in...
Thank you so much. Right Honourable Speaker, we appreciate Parliament for accepting that we upgrade some hospitals. But before we go to that, Right Honourable Speaker, it is the policy of the government to make sure that every constituency has at least a health center for. This one assists to decongest the hospitals and the referral hospitals. But it is very unfortunate that much as some of us we are celebrating from the other wing, in my constituency, where even UPDF was...
Which one? Which constituency now?
No, your constituency is still Igara West because I'm still representing them up to the end of May. So, Right Honourable Speaker, it is very unfortunate that in my constituency, government had actually brought contractors on site, the UPDF, whom they've been singing they are so effective, but I'm yet to see because they normally sit here and I've never seen them anyway. But anyway, Right Honourable Speaker, the point I'm bringing, as government is planning to upgrade other hospitals, how about other constituencies without even a single health center for? So my prayer, Right Honorable Speaker, is that this government of ours, are you writing, Honorable Bahati? Okay, this government of ours must pull up stockings, because you can even see the bench, Right Honorable Speaker, is empty, almost empty, to make sure that our views can be taken up. So my prayer is to make sure even constituencies that are not yet accredited with health center force, it is our right. We are seeking your favor, because we have also a connection. You can do also a muramu all the way from the other side to make sure that we also get that favor. I thank you, Right Honorable
Honorable
Speaker.
members, I did not give any favor. It is government responsibility to ensure that it delivers what is expected in terms of service delivery, the hospitals, the schools, the roads, all those things. My work is just to chair this house. When you're making appropriation, I chair when you're making appropriation for the good of this whole country. And I will never tell you that let's appropriate for where I come from first. No. I do not look at where I come from first. Okay? Yes, Ethel, we need to have a comprehensive study on issues of health care. Where you have a sub-county that does not even have a health center for, a county which has no health center for. We need to look at that and see how we can make priority in the next budgeting season.
Madam Speaker, my prayer, some of the new districts like Kalungu, we have original hospitals under the Catholic Foundation or Church of Uganda. And when you visit Villa Maria Hospital, it has facilities better than Health Center Force. One time I went to Zombo. There's another Catholic hospital there. But there was a policy which was helping these hospitals to run. In Kalungu, where I come from, Villa Maria Hospital works on Sembabule, works on Chiruhura.
That is a PHC.
Yes, works on Gomba. But we don't have doctors because those hospitals cannot afford paying doctors. And if a policy can be worked on, and the government can post some doctors in these hospitals, even the
Honorable Bahati, Minister, that's a very important point. There are some private-owned hospitals, like church-owned hospital, even privately owned by other people. If government can only do one thing, send doctors in those hospitals, and then they will give treatment as a subsidized rate, it would help.
Madam Speaker, as I conclude, if you go to Villa Maria Hospital, where I come from and where I was born, they have enough facilities, they have accommodation for doctors, first-class houses, but because they're incapacitated by income, based on the income of the people, they cannot, but they are seeking guidance and help from government, as you have, I'm going to give information, as you have stated. It could solve a lot of issues because already they're established and the government is giving some little money, but employing doctors, nurses is very key.
There is rehabilitation of hospitals, health centers. There is a special category of patients, and those are the mentally sick patients left out. They will upgrade the HIV section, they'll upgrade maternity wards, but you'll never find any upgrade taking place in the mental health clinics. It has come to a notion that the mentally sick are now being thrown at the backyard of the hospital. With a report given 1 month back by the director of Butabika, Dr. Nako, they need 2.4 billion so that they can employ more medics to handle these patients. So,
you see the problem? Some of you have been trained in that like you. Now want to come into politics. He's trained in mental health. They are all running into politics. That's why we are missing out. Anyway, we need that money for the mental health.
Thank you so much, Right Honourable Speaker.
Yes.
Most obliged.
Thank you.
About matters of health, the leader of government business is not in Parliament. The Minister of Health, Honorable Bahati could write, but you know that lately, Honorable Bahati also was hated by those people to the extent that even they rigged him out in the primaries. I don't know if he can still talk to those people.
Honorable,
No, I know they rigged my brother out.
Honorable saying, Medad,
Yes, it is a fact.
Honorable Medad, you're also going to be rigged out. You
Yes,
wait.
I know. That's why I'm complaining in advance. Because if it happens to my brother, it can happen to me. But then, I don't know if he can still talk to those people and they understand.
He does. He does. We are all in one government. Don't worry.
Thank you very much, Right Honourable Speaker. Why I threw my full weight behind that loan for refurbishment of Bujiri Hospital is because Bujiri Hospital, Bududa Hospital are among the 22 hospitals that were constructed after independence by the late Dr. Milton Obote. And the concern
by his government.
The concern is that we have of the deplorable state of these hospitals are almost similar. The buildings are dilapidated, and the case of Bududa is even worse because during critical health crisis, during disasters, it is overwhelmed by casualty cases, which are referred to Mbale, and you know, the hospital state, Sore state is conjoined to the state, to the deplorable state of the road. And it becomes very difficult for some of these emergency cases to reach the referral hospital of Mbale. And you know, Bududa Hospital, I must say, this petition that has come from Soroti Hospital and others is a blessing in disguise. So that maybe the House recoils back and plans better for all these dilapidated hospitals. Because Bududa Hospital serves not only Uganda, it has over 5 districts within Uganda, from Namisindwa, Manafas, Ronko, parts of Mbale, but Kenya majorly. At one time, I think 4 years ago, when there was an outbreak of dysentery in the neighboring Kenya, most of those cases were actually brought to Bududa Hospital. And we ended up again having many of our people affected by the same. So I would conclude with...
To me, allow me to thank you for fighting for Ugandans. But there is something disturbing me. I come from Katerera constituency, whereby I represent the people of Katerera. I have 5 sub-counties. The good thing with our government, they have provided for us health center 3s. Where there is health center 4, it is almost 16 kilometers from Katerera. Last year, we lost 2 women with their babies in their thighs because of lacking health center 4. At the same time, the roads are very bad. So, Right Honourable Speaker, it disturbs my mind whereby I need your advice. We have given over 20 billion to rehabilitate Bujiri Hospital. I mean, $20 million.
$20 million.
Whereas in my constituency, I need only about 2 or 1 billion to have health center for. Kindly, I request our good government, give us priorities. Other constituencies also, they have health center for. Our people are dying. I thank you very much, Right Honourable Speaker.
And if we should take priority of all the hospitals, let's look at all the health sector for us to be able to manage. Because if you look at such a distance, the best thing would be to make a health center 3 where somebody can go and give birth, other than going to a district hospital or to the health center 4. We need to equip those health centers. Yes,
Much
Josephine.
obliged, Right Honourable Speaker.
Thank you.
Honourable Speaker, yesterday we joined the people of Bujiri in celebrating, however momentarily it might be, that Parliament gave a green light for these 20 million US dollars to be gotten to rehabilitate Bujiri Hospital, because that hospital is very sick. That's for sure. I am hoping that the excitement for the people of Bujiri will not be momentary. For many reasons. You know, many times we borrow money and it remains undisbursed. I hope this won't be the case, because as of end of last year, in our country's record books, we had 16.4 trillion Uganda shillings undisbursed loans. And last year, as a country, we paid 74 billion shillings in commitment fees. Those are fines you pay for money that was lent to you, but you're not utilizing it. Because once the lender lends you money, they don't care whether you're utilizing the money or not, they have lent you. So last year, this is 74 billion shillings, which is like getting and you throw in a pit lottery. Commitment fees. And the 16.4 trillion remains undisbursed. We need to stop this. Government, come and borrow money when you're ready to utilize it. Now, my honorable brother might be excited, but then another, I don't know how many years might elapse before this money is released and the hospital gets to be refurbished. Because we have seen this happen again and again. Hopefully, we'll get to do better. Because you see, our debt burden continues to grow. We are now at 107 trillion shillings. But you see, a good chunk of that is money we are not utilizing. So why do we borrow it if we are not ready to put it to use? Why? It does not make sense at all. I hope this is not one of those cases. But, Honourable Speaker, also, we hope that for the umpteenth time, government can come with a comprehensive plan to refurbish health facilities in this country. Whether it be the infrastructure, whether it be staffing, all these are numerous challenges across. Busoga region alone, where Bujiri falls, as per the 2024 National Population and Housing Census, has got an approximate population of 4.37 million people. That's just Busoga region alone. How many functional hospitals are in that region? It's the second largest population by region. How many can you talk about? And that's why now, Bujiri is very excited that at least money has been borrowed to deal with this one. Now you widen the circle, go outside of Busoga. If every member in this house across the aisle got a chance to talk about the health care situation in their constituency, you would be appalled. Health centers are non-functional, there's no doctors, theaters are full of bats and rats, theaters. In fact, doctors fear to go there. They say, we cannot go and work in those places. People are taken there, and what is there is probably Panadol. We need a comprehensive plan to revamp healthcare in this country. We cannot just do it piecemeal. Until when? You come with a comprehensive plan, tell us that for all your health centers, we are going to borrow money, however unsustainable that is. But let there be a plan. Let's come here and debate that plan. Okay. Tell us this is what we want to do. This is how we are going to find that money, so that we deal with the healthcare challenge in the entire country. Thank you.
Thank you. Honorable members in the public gallery this afternoon, as you've heard about revamping the whole health sector, and we have all this needs a multi-sectoral approach. When you talk about, you find some hospitals have no electricity because they cannot pay electricity. So women are delivering and they are using torches to give birth. You have the bad roads. For you to reach a hospital, there must be a bad road. Just like when you're entering the city here. If you don't get potholes, then you're not entering the city. And then the issue of personnel. There are no personnel. Some of them don't have drugs. And then some of them really are in a dire state. So Over to you.
Thank you, Madam Speaker and honorable colleagues, for the discussion, this important matter of health. And I want to thank the Leader of Opposition for the insight into this debate. I just wanted to first clear one simple thing. While I was seated there, Madam Speaker, on the parliamentary website, somebody posted that on the right moment, MP Segona challenges Minister Bahati's capacity to represent government on the floor. I wanted to say on the firm note that I have overwhelming capacity to represent government on this floor.
It is on the record.
It's on the record.
And the Honorable this financial year. So as government, you may need to come out and tell this country what next. What is in your next plan?
So we have the concerns of members, and I'm sure that these concerns have come at a very appropriate time when we're actually going to start the budget preparations, and where we'll have the budget framework paper. This budget framework paper lays out the strategy and the outlook of how things would work in the next financial year. So we hope that this parliament, members of parliament, will have valuable input in the budget framework paper. I just wanted to mention two things. One, to confirm that all the issues that have been raised, I do not know, Madam Speaker, how would you want us to take this, but I would propose that the Minister of Health should come, if you do accept, to again make a presentation here on how we are moving in terms of the health sector, and then maybe the Committee of Health can also look at this matter, and then as we debate and discuss the budget framework paper, then we can improve on how the health sector will look like next financial year. But as you know, the policy of government on health is to have, among other things, a national referral hospital, to have a regional hospital, to have a district hospital, a health center 4, and health center 3. Out of this, we are making some good progress. In some districts, actually, we have covered this. For example, district where I come from, Kabale, most of these things are in place. And we have seen benefits of the things that can be done when you have good functional health center 3. I want to tell you that in my own constituency alone, health center 3s help over 600 mothers to produce every month. So this can really make some good progress. But also you made a point, Madam Speaker and other members, one, that there are foundational bodies that have health units. There are even private sector hospitals. I know some of the hospitals that have 200 beds, but they are not supported by government. I know we have PHC, money that comes from government to support these foundational bodies, but it's not enough. So these are some of the things that the Minister of Health will be able to sort out, to talk about when it comes to when you give her an opportunity to make a presentation. But I think it's a good idea that government comes in to work hand in hand with the private sector. I know for sure, like in Nansana, one of my friends has a hospital which has more than 20 beds of dialysis beds, more than what is at Mulago, what is at other hospitals. So if we work together with the private sector, we can achieve more. So, Madam Speaker, I'll be able to convey the message and request that when you avail the opportunity, the Minister of Health will be able to make a presentation here on the floor.
Honorable Yume, but before he comes to that information, Dr. Yume and Dr. Muze will bear me witness. In my private hospital, I have over 200 beds. We do major operations, we do everything. The women give birth for free. For free. what would it cost the government to say, let's support that hospital by giving them midwives and gynecologists? Because they are giving birth for free, they get treatment for free. That is giving back to community. But government should be able to support. Yes, Dr. Yume?
Yes, the health sector has deficiencies, but I think we should not demonize it. There are indicators that we look at to look at progress of the health sector. And I want to tell this House and those watching and listening, maternal mortality, which is one of those indicators that we use to determine progress of the health sector. The maternal mortality of Uganda, Right Honorable Speaker, over the last 5 years has jumped from 330 deaths to 189, and it's one of the best in the region. Remember, Right Honorable Speaker, we were coming out of COVID, we were coming out of Ebola, and the chronic strikes. So I think we deserve a clap as government and as Parliament. Right Honorable Speaker, there has also been tremendous investment in infrastructure in the health sector, and in the Lobes constituency, we have yet to be one of the best heart hospitals in Africa, and I think the Right Honorable Prime Minister did the groundbreaking in February. It was a $79 loan from the Saudi fund, and once complete, we shall stop our heart patients going to Turkey, to India. So those are some of the things, and I think 3 weeks ago there was a loan request for a cancer center in Arua. The one in Bale will be soon coming aboard. It was in the same loan request by the Minister of Finance, and then Mbarara and so forth. So the issue, Right Honorable Speaker, is about appropriation. Once given the right funds, I think the Minister of Health and the Ministry of Health would be in the right direction. The 10th Parliament, Right Honorable Speaker, as I conclude, was able to borrow money, and I think over 200 health center 3s were built, and it's that same reason that we're able to see our maternal mortality reduce. So I would like to implore the House that avail the necessary funds, and we can revamp all these health center 4s we are talking about, all the ambulances that we need, and all the general hospitals that we need. I thank you, Right Honorable Speaker.
Thank you, Honorable Minister.
Dr. Ayume, and in addition, as you know, in terms of the progress we're making in the health sector, our life expectancy has now increased to 63 years, up from 41 years in 1991. This is because of the good programs of the NRM government and supported by all of you. We are also having a plan. Madam Speaker, one of the questions that has been raised here is the personnel at the Health Center 3s and Health Center 4s. We are having a plan to recruit doctors, medical doctors, at Health Center 3s if resources allow. So these are some of the things that we shall be able to discuss during the budget framework paper, which is coming in December.